All right, let's dive into our first topic and discuss the causes and risk factors of epilepsy. Epilepsy is a neurological condition characterized by recurrent, unprovoked seizures. These seizures occur when there is a sudden surge of electrical activity in the brain, disrupting its normal functioning. Now, you might be wondering what causes epilepsy and what factors can increase the risk of developing the seizure disorder. Firstly, genetic predisposition plays a significant role in the development of epilepsy. Research has shown that some types of epilepsy are inherited, with specific genes making an individual more susceptible to seizures. However, it's important to note that not all cases of epilepsy are solely due to genetics. Another major cause of epilepsy is brain injury. This can result from various factors, such as traumatic head injuries, stroke, or lack of oxygen during birth. For example, a car accident or a sports injury that causes significant head trauma can lead to the development of epilepsy later in life. Similarly, a stroke or oxygen deprivation during birth can damage brain cells and increase the risk of seizures. Infections can also contribute to the development of epilepsy. Conditions like meningitis, encephalitis, and even some parasitic infections can cause inflammation in the brain, leading to seizures. It's crucial to treat these infections promptly and effectively to reduce the risk of epilepsy. Other risk factors include brain abnormalities present at birth, such as malformations or abnormal blood vessels. Moreover, certain medical conditions like Alzheimer's disease or brain tumors can also increase the risk of epilepsy. In some cases, the cause of epilepsy remains unknown, which is referred to as idiopathic epilepsy. It's important to remember that epilepsy can affect anyone, regardless of age, gender, or ethnicity. However, understanding these causes and risk factors can help in early detection and management of this neurological condition. Moving on to our second topic, let's discuss the different types of seizures and their respective symptoms. This knowledge is crucial for effectively identifying and responding to an epileptic event. Seizures are generally classified into three main categories: focal onset, generalized onset, and unknown onset. Focal onset seizures, also known as partial seizures, occur when the abnormal electrical activity starts in one specific area of the brain. These seizures can be further divided into two subcategories: simple partial seizures and complex partial seizures. Simple partial seizures involve no loss of consciousness, while complex partial seizures may cause a brief loss of awareness. Symptoms of focal onset seizures vary depending on the affected area of the brain, but can include involuntary muscle movements, changes in sensation, or even alterations in emotions. Generalized onset seizures, on the other hand, involve both sides of the brain simultaneously. These seizures can be further classified into several subtypes, such as absence seizures, tonic-clonic seizures, myoclonic seizures, and more. Absence seizures, previously known as petit mal seizures, cause a brief loss of consciousness and may appear as a blank stare or subtle body movements. Tonic-clonic seizures formerly called grand mal seizures, are the most commonly recognized type and involve a sudden loss of consciousness, muscle stiffness, and convulsions. Myoclonic seizures involve brief, sudden jerks of the muscles, which can resemble a startle response. Lastly, unknown onset seizures are those where the origin cannot be determined. This classification is used when there's not enough information to determine if the seizure is focal or generalized. As more information becomes available, the classification may change. Recognizing the different types of seizures and their symptoms is crucial in providing the appropriate care and support to someone experiencing an epileptic event, but also helps in understanding the underlying cause and selecting the most suitable treatment option. Now that we've covered the types of seizures, let's discuss the diagnostic process for epilepsy. Accurate diagnosis is essential for determining the most effective treatment plan for an individual with epilepsy. The diagnostic process typically involves several steps, including medical history evaluation, neurological examination, and various tests. First and foremost, a thorough medical history evaluation is conducted. During this evaluation, the healthcare professional will ask about the patient's seizure episodes, any possible triggers, and the patient's overall health. They'll also inquire about family history, as epilepsy can sometimes have a genetic component. Providing accurate and detailed information about one's medical history is crucial for helping the healthcare professional make an informed diagnosis. The next step in the diagnostic process is a neurological examination. This examination focuses on assessing the patient's brain and nervous system functions. The healthcare professional will evaluate various aspects, such as muscle strength, reflexes, coordination, memory, and speech. This assessment helps identify any abnormalities that may be contributing to the seizure episodes. Following the neurological examination, a series of tests may be performed to further investigate the nature of the condition. Some of the common tests include 1. Electroencephalogram. This test records the electrical activity of the brain and can help identify abnormal patterns associated with seizures. It's a crucial test for diagnosing epilepsy and determining the seizure type. And 2, magnetic resonance imaging, MRI. An MRI scan provides detailed images of the brain, which can help identify structural abnormalities or lesions that may be causing seizures. 3, computed tomography scan. A CT scan can also be used to identify brain abnormalities or lesions, although it's less detailed compared to an MRI. However, it's often faster and more readily available in some cases. 4, blood tests. Blood tests can help rule out underlying conditions that may be causing seizures, such as infections or metabolic imbalances. These tests, along with the medical history evaluation and neurological examination, help healthcare professionals accurately diagnose epilepsy and determine the most appropriate treatment plan for the individual. Understanding the diagnostic process is essential for individuals with epilepsy and their families, as it provides insight into the nature of the condition and helps guide future management strategies. Let's move on to our fourth topic and explore the various treatment options available for managing epilepsy. The primary goal of epilepsy treatment is to reduce or eliminate seizure frequency while minimizing side effects. Treatment plans are tailored to the individual's specific needs and can include anti-seizure medications, lifestyle changes, dietary interventions, and in some cases, surgical interventions. Anti-seizure medications, also known as anticonvulsants or anti-epileptic drugs, are the most common form of treatment for epilepsy. These medications work by altering the electrical activity in the brain, reducing the likelihood of seizures. There are several different types of anti-seizure medications, and finding the right one or combination of medications may require some trial and error. It's essential to work closely with your healthcare provider to find the most effective medication regimen with the least side effects. Lifestyle changes can also play a significant role in managing epilepsy. This may include maintaining a consistent sleep schedule, managing stress, and avoiding known seizure triggers, such as flashing lights or excessive alcohol consumption. Regular exercise can also be beneficial, but it's essential to discuss any new exercise routines with your healthcare provider to ensure they are safe and suitable for your specific situation. Dietary interventions, such as the ketogenic diet, have shown promising results in managing epilepsy, particularly in cases where medications are not fully effective. The ketogenic diet is a high-fat, low-carbohydrate diet that shifts the body's metabolism from glucose to ketones, which may help reduce seizure frequency. However, it's crucial to consult a healthcare professional or a dietitian before starting any new dietary intervention, as it may not be suitable for everyone. Lastly, surgical interventions may be considered for individuals who do not respond well to medications or dietary interventions. These procedures usually involve removing the area of the brain responsible for the seizures, or implanting a device to help control seizure activity. Surgical options should be thoroughly discussed with a healthcare professional to weigh the potential benefits and risks. In conclusion, managing epilepsy requires a multifaceted approach that may include medications, lifestyle changes, dietary interventions, and possibly surgical interventions. The appropriate treatment plan will depend on the individual's specific needs and should be determined in collaboration with a healthcare professional. By exploring these various treatment options, individuals with epilepsy can work towards improving their quality of life and reducing the impact of this neurological disorder. As we reach our final topic, let's discuss the importance of first aid measures and safety precautions during a seizure, as well as the significance of emotional support and awareness for individuals with epilepsy and their families. Knowing how to respond during a seizure can make a significant difference in ensuring the safety and well-being of the affected individual. When witnessing a seizure, it's essential to remain calm and follow these first aid measures. 1. Ensure the person's safety. Clear the area of any sharp or dangerous objects to prevent injury. If they are standing, gently guide them to a safe lying position on the ground. 2. A positive. Cushion their head. Place something soft, like a folded jacket or pillow, under the person's head to protect it from injury. 3. Time the seizure. Keep track of the duration of the seizure. If it lasts longer than 5 minutes, or if the person has multiple seizures without regaining consciousness, call emergency medical services immediately. 4. Turn the person onto their side. This position, known as the recovery position, helps keep their airway clear and prevents choking. 5 must stay with the person. Remain by their side until the seizure is over and they are fully conscious. Offer reassurance and support as they regain awareness. It's crucial to avoid restraining the person or placing anything in their mouth during the seizure. These actions can cause more harm than good. In addition to first aid measures, emotional support and awareness are vital for individuals with epilepsy and their families. Living with epilepsy can be challenging, and having a strong support system can significantly impact one's quality of life. Encourage open communication about the condition and its effects, and offer reassurance and understanding. Furthermore, raising awareness about epilepsy can help reduce the stigma and misconceptions surrounding the condition. By educating others and promoting understanding, we can create a more inclusive and supportive environment for individuals with epilepsy and their families. In conclusion, knowing how to provide first aid during a seizure and offering emotional support and awareness are essential aspects of helping individuals with epilepsy and their families cope with the condition. Together, we can work towards a more informed and compassionate society that provides the necessary support for those affected by epilepsy.